Big changes happening at hospitals. Nurses across the country are now demanding hospitals invest in safe staffing measures for them. In California, nurses are protesting the Department of Public Health decision to allow COVID-positive nurses to head back to work without isolating. KION's Lisa Principe live for us tonight at Dominican Hospital to explain. Lisa.
Nurses with Dominican Hospital were out here rallying earlier today, saying that state and hospital policies are leaving them overworked with no support.
Some nurses, when there's not enough staff because injuries or illnesses, they've been forced to be on call for 24 hours with no support.
We really want patients to be prioritized over profits.
Fears of knowingly spreading the coronavirus. Healthcare workers are speaking up across the state, raising concerns over the California Department of Public Health's new guidance that went into effect over the weekend. CDPH now says workers who test positive but show no symptoms can return to work immediately without isolation or testing, but they must wear fitted N95 masks.
If you were sitting next to a COVID positive patient, how would you feel? I don't think anybody in this community would feel okay with that. And so we're asking the hospital to not be okay with that.
The state announced the move, citing critical staffing shortages, but these nurses at Dominican Hospital say the staffing problems existed long before the pandemic.
They've cut CNAs, they've cut EVS. We've got garbage cans that are overflowing in patients' rooms. We've got dirty linen that's overflowing. And then nurses have to do that. Nurses are now being pulled from taking care of your mother who's lying in a bed of feces because they have to go empty the garbage or empty the linen because it's all over the place.
They say job postings stay unfilled for months, and many travel nurses who temporarily fill positions and do want to stay can't afford to live in the county. Dominican Hospital released a statement to KION in response, saying in part, the CDPH guidelines will be implemented only if the hospital is facing a staffing shortage that would jeopardize its ability to provide care. They say they have not yet had to implement those guidelines, but may have to in the near future. They added that they have been actively recruiting and hiring staff and have implemented processes to expedite onboarding. The county is currently looking at other options to at least give medical staff more support.
We're looking at possibly posting paramedics and EMTs in the emergency department, bringing some other non-medical volunteers to kind of stretch this out. But I think the important thing going forward is that we have to recognize that we're going to need to rebuild our healthcare system.
The Department of Public Health said that the new guidance should only be used after exhausting all other options, and that COVID-positive workers should only interact with COVID-positive patients. In Santa Cruz, Lisa Principe, KION News Channel 546.
Well, the state's new rules will be in effect through February 1st.